Sawasdee Krap and good afternoon once again. Today is Thursday, the 22nd of April 2021, and this is the English language summary of the daily press briefing here at the CCSA as always. So firstly, just to highlight that today is Earth Day, and the theme is Restore Our Earth, with the hope that we will be all of us will be healthy and live in a green and safe world in the near future. Earth Day today. Dr. Twisin, thank you for the Thai language edition of the briefing. He ended with a piece of information about hospital beds. As I mentioned, hospital beds is actually a work in progress, a management in progress, which we're doing right now. And the highlight of that is that His Excellency the Prime Minister had actually assigned someone to call the different hotlines yesterday, 1669, 1668, 1330, the medical emergency hotlines that we have for people to consult with the Department of Disease Control and the Health Ministry and the emergency agencies, medical services, to consult with them and to request for beds once they have been found having COVID symptoms. Now, the Prime Minister had assigned his staff to test these hotline numbers and had ordered for the expansion of the various hotlines so that there will be people answering these hotlines and to become more effective in its work of coordination, and so that people calling in will be having experts to consult with and to request for beds in the supplies that we have right now. So that's something that the Prime Minister had personally been looking into and then assigning the appropriate staff to look into. So I'll start off first with the number of cases that we have for today. And the slide will be coming up for you soon. Today we have a new confirmed case as 1,470 cases, as you can see on screen. Out of that number, 1,370 are from local transmission, the majority. And 100 cases, the rest of the cases, 100 of those cases are from active case finding. We have 447 new recoveries recorded for today. We have 7 new fatalities to report, unfortunately, making the cumulative number of fatalities standing at 117. The active cases currently is counted as total 18,148. 18,000 active cases being treated right now in Thailand. So on the 7 new fatalities, and of course our sincere condolences to the families of the fatalities, we have some information on that for you. The 111th fatality is a 24-year-old businesswoman from Patalung province with a history of visiting an entertainment venue in Suratani province, where confirmed COVID cases were found. The 112th fatality is a 68-year-old woman with pre-existing conditions such as asthma and was in contact with an infected person. The 113th fatality is an 83-year-old man from Bangkok with conditions of high blood pressure. The 114th fatality is an 80-year-old woman with conditions of diabetes and other hypothermia. The 115th fatality is a 45-year-old woman in Bangkok with high blood pressure and also hypothermia. So we have some more information on that, which is 116th fatality, a 59-year-old man in Bangkok with diabetes and history of contact with an infected person. 117th fatality is an 86-year-old man with pre-existing conditions of heart disease, resident of Bangkok, and came into close contact with a confirmed COVID case. So that's seven fatalities reported for today. That's a high number for fatalities in Thailand. So hoping that we will not have to repeat this kind of reporting of high number of fatalities in Thailand in the near future. Another piece of information that Dr. Tuisin had mentioned is about the stroke-like conditions. People having been inoculated with vaccines and having the occurrence of stroke-like conditions. Now, this is being looked into detail with the analysis of the connection with the vaccinations. However, the conditions, the after effects of vaccines of having stroke-like conditions are not actually strokes, and they have not been severe. Therefore, in the general picture, the vaccine plan will still continue with particular attention paid to these particular symptoms of stroke-like symptoms. So that will be studied in due course as we continue with the vaccination plan. Another piece of information, you saw various maps being shown on screen today. There had been some good news regarding Chiang Mai, wherein the infection rate had slightly improved from moving down from the dark red to the orange zone category with less infections in Chiang Mai. However, nationwide, you can see in our information that nationwide the numbers are not that stable yet. So we still have to be very, very careful. And because of this, there had been new clusters reported particularly highlighted in 3 provinces in the central region, namely Ang Thong, Ayutthaya province, Ang Thong province, Ayutthaya province, as well as Nakhon Ratchasima province. Now, basically, these 3 provinces had experienced new but quite small clusters, but new clusters, mostly found from people who had visited entertainment venues or held parties and gatherings in these provinces. The application Thai Stop COVID Plus is a risk assessment application which had been launched for venues, including venues of the private sector, offices and the like, to be able to assess their risk, whether the venues had been following and implementing with the various measures involved in a sufficient manner, sufficient prevention in place or not. Now, this application had been put in place for private organizations and had been used in the past weeks already. The result of this so far is that 91% of venues that had tested entered into the application and tested and answered the questions and according to the criteria and the measures, 91% had actually passed so far. But as more and more venues use this risk assessment platform or application, we will be able to monitor and see how far, how good, how effective the implementation of the measures in private organizations, private entities and venues are, in fact. Dr. Tuisin also talked about today regarding a piece of information that might be useful for foreign nationals. In that, of course, right now the online system of the Immigration Department is under maintenance, under repair. But still there is the need for foreign nationals, according to the regulations, to report their residence every 3 months. So usually there are 3 ways of doing this. First is online, which as of now is the system is being maintained, being repaired. That's the first way. The second way is by post, by mail, and the third way is in person. So the recommendation now is that foreign nationals who have to report their residence every 3 months to immigration should do this by post, by mail, by writing a letter to confirm and report of their residence every 3 months. So this is the recommendation that we had come up with following the CCSA meeting this morning as one of the issues discussed. However, as soon as we have more detail on this or an announcement by immigration, we will be talking about this in due course. So that's the initial recommendation for those who have to report their residence to immigration. So just some additional information quickly on a particular province, on Suratani province, compulsory mask wearing. So the governor of Suratani issued an order for compulsory mask wearing in the public area, and those caught not wearing masks will face a fine of no more than 20,000 baht. And the order was effective from yesterday, the 20th of April, until further notice. So this is just one example of a local order from a local province, specifically for the province of Suratani regarding masks. Also, just quickly, another piece of information. We have an infographic coming up, I believe, on free taxi transportation for patients from Ratchavithi Hospital in Bangkok. So that's being offered in order to assist with those who have to come to Ratchavithi Hospital, and so that they will not be spreading the infection to the drivers or other people who are using public transportation. So this is a free taxi transportation from Ratchavithi hospitals and other hospitals from 9 a.m. to 7 p.m. In Bangkok and its vicinity to assist with the rising cases of COVID. Now, that form is found online with a QR code, as you see on screen. So details, you can look into the details of that on social media. Also, since of course we are mostly working from home on home quarantine at the moment, what's important is for us to be able to work. I think that's very important for everyone. So therefore, the internet quality is an important factor. The National Broadcasting and Telecommunications Commission, or NBTC, has instructed telecom operators to oversee the quality of their internet network, the network bandwidth, to support more users working from home and field hospitals following the fresh wave of infections. Of course, communications is very important during crisis, and the service providers must scale up the capacity as well as maintain and repair the equipment, the infrastructure involved to ensure continuous network availability. So that's very good news for those working from home. So before ending today, I'd just like to end with talking about that the majority of fatalities this month continue to be linked to entertainment venues and markets, fresh market clusters, while half of which are close contacts with infected family members. Most of the fatalities are the elderly. I mentioned this often before, 60-year-old and up. Most of the fatalities are 60 or more of age with pre-existing medical conditions, while those transmitting the infection are the younger generation, those who are at the working level, those who are quite young. They move around and have high mobility. So those two age groups are very important factors in preventing the spread of COVID. And of course, if you have elderly people, parents or grandparents, please limit your contact with them in order to avoid the risk of them having infected with COVID. But of course, telephone calls, video conference, Zoom, line application, those are alternative means and the better means, the safer means to contact with your loved ones who are in the elderly group. So we continue to ask for your kind cooperation to practice social distancing, or at best avoid contact with the elderly to protect your loved one. So this ends my presentation for today. Thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพันธ์